Welcome to Little Legs podcast. It's really good to have you here. And it's a safe space to talk about pretty much anything parent related. And what I'm really pleased about today is that my guest is a dad. So first dad on the Little Legs podcast. So thank you. Please introduce yourself.
Thank you for having me. I'm Ali Cornwall. I'm a dad. My wife is recently joining Little Legs to become an instructor or whatever you call them. I don't know. So that's Leanne for anyone in the local area that when she starts doing her classes and things, and that's how we kind of met. So Jessica's not long turned one, had quite a traumatic start, which we'll probably go into. But yeah, that's me.
I love the fact that you were in the meeting when me and Leanne were discussing her joining, and you're like, I don't know what she's doing, but it's fine. I forgive you. Yeah, she's going to be a Little Legs instructor.
Yeah.
It was so fun. So, honestly, but I'll forgive you because if anyone asks me what my husband does, I generally say spreadsheets. I'm sure it's a bit more than that, but yeah, that's colour coordinated stuff. So I do forgive you. You've got Jessica, only child, married to Leanne, which is wonderful. But tell me about the early days for you. What was that like?
So pregnancy was fine, if you're with me. Like, that whole journey was okay. Leanne had to go through a few extra precautionary scans, so we had more than the normal scans. Long story short, Leanne had cervical cancer about 15 years ago, I want to say. So in her quite early 20s, which from my point of view made me, I won't say not want children, but just kind of put the fear in me a little bit that I wanted a wife and not to be a single dad. And it took me a while mentally. Kind of didn't realise it at the time, just to kind of be okay with having a child, which kind of, I'm saying that now because it'll come into the story later.
Yeah. Okay.
So other than that, it was okay. There was a lot of talks about potentially Leanne needing maybe an extra a stitch in the cervix or something because of having some of it removed, but everything was okay. Like I say, we just had lots of extra scans just to make sure everything was okay, which I'm not complaining about. It meant we only paid for one private one, which was is it at the 8-week stage or something like that, you can have your first scan. But yeah, so it meant that everything was checked regularly, and she had extra consultancy, which probably out the norm, but it was nice for us because we could pretty much every 2 to 3 weeks we're at the hospital having a scan.
May I jump in there? Were you nervous about your scans?
Initially, yes. And then, I don't know if this is the same for everyone, but when it's your first, they say things to you like, oh, the head's a bit small, or this isn't quite as big. And then after the third or fourth time, when they scan it one day, and then like you come back a week later or the next day and, oh, actually, no, you're on this such and such percentile and all that, you kind of learn that. And I don't know why it's like this, but the technology we use is so antiquated and sometimes at best a plumber's estimate that you just kind of go with the flow because depending on who it is and the position of the baby and why technology hasn't improved with it, I don't know. Initially, yes, we were nervous just to make, because we were told that the percentage of Leanne potentially having a miscarriage was a little bit higher because of the operation she had to have previously. But yeah, everything was fine. We just kind of rolled with it eventually.
I think the silence was the scariest of the scans because obviously they're concentrating and it took all my strength to go, is everything okay? Is everything okay? Because it's the silence, isn't it? But obviously you'd got that extra added, so there's a lot of stress. So thank you.
Yeah.
For clarifying.
Yeah. And one of the hardest bit is not looking, because obviously it's your pride and joy that you're now seeing on a screen. But because we didn't want to know the gender, we were looking away, and it was so hard. Like, if you can feel your neck muscles pulling towards the screen, like, no, I'm not looking. So yeah, we went through the entire process, literally until Jessica was born, that we didn't know the gender either. Wow. So we managed to keep that a nice surprise, because you don't get many nice surprises in life.
Yeah, no, absolutely. Oh, I love that.
Yeah. Then, I guess, moving on to the birth, that was, shall we say, a little bit traumatic. So Leanne went into labour, I can't remember what day it was now, but we went in on an evening. She was not quite fully dilated, but because we were at Nottingham City and we're kind of on the border of Nottingham and Derby, so we're just near Hena. Yeah. But we went to Nottingham City because that's where Leanne had her procedure. They had all her notes, her consultants were there, etc. So we went there and they said, basically, you kind of get in there, but you're not quite there, but we don't want to send you home. So we got admitted that night. I think it was about 10 o'clock at night, something like that, when we got up to the ward. Then I think it was about 9 o'clock in the morning, one of the midwives came in, actually broke Leanne's waters for her and said, yes, you are now dilated enough to go into the labour suite. And then we went through labour, and we didn't actually, if we'd have given birth on that day, we would have been in that, is it 5% club or something, of children being born on their actual due date. But Jessica held on until the next morning. So we had quite a long ordeal. But when we got to the actual birth, I don't know whether Jessica got stuck or it was just Leanne was just absolutely knackered, bless her. But we had to have the Kiwi cup to help pull her out and a episiotomy, which, you know, wasn't too bad. But it was after that, when halfway through the kind of labour process, there was meconium found.
Yep.
But they weren't too worried about that. And me and Leanne were a bit confused with that because we was always told that if there's meconium, you have to get them out ASAP. But apparently the heart rate was still okay and things, so they weren't concerned with it. So anyway, the birth happened. Obviously, Leanne was absolutely knackered, probably in a lot of pain. But it kind of went downhill from there because they couldn't stop the bleeding from the episiotomy. And her placenta wouldn't come away despite having the injection to help release it. So Leanne was kind of hemorrhaging blood to the point that she then had to be rushed into theatre. So she held Jessica for a bit. I then was giving Jessica because Leanne started to not pass out, but go a bit faint because of the loss of blood. So she then got whisked off to the theatre room to have that removed because they just, at one point, they pressed the button and I can't tell you how many nurses and doctors were in that room at the time. So I was holding Jessica in the chair, a little bit meconium being spit up on that, but, you know, I was having that skin to skin with her.
Yeah.
Leanne got whisked away. She ended up losing, I think it was 2.3 litres of blood.
Oh my goodness.
So she lost a lot. I didn't realise that, and it makes sense, when you're pregnant, I think you get about 2 point something litres of blood anyway. So the extra that Leanne produced during pregnancy, she kind of lost that. So she had to have 2 bags of iron and 2 bags of blood afterwards.
Wow.
So she went away after we had like a debrief and things afterwards, but apparently I had Jessica for at least an hour. So I was looking after her and cleaning her up a bit and doing all that. People kept coming in and doing things. And then she spit up a little bit of blood, which panicked me, but apparently it's normal. But I pressed the button just to say, oh, she's spat up blood. You know, it's my first baby. And then they came in and did it OBS and her oxygen levels had gone down to 30%. So then they pulled the big boy button.
Oh, God.
And then Jessica ended up being whisked down to neonatal. So then I was left in the labour suite on my own with no baby, no wife, not knowing what was going on, kind of almost my worst nightmare coming true, and just a pool of blood on the floor in the labour room.
Oh my God. And 2 big bad boy buttons been pressed in a very short space of time.
Yeah. So apparently all of this kind of lasted about 2 to 3 hours in total from Jessica being born and all of that. Leanne came back. They said you could go and see her because when she was being wheeled away, she was worried about me. Obviously, we'd had conversations. We've got quite a very open relationship in the sense of talking about emotions and things. And she was worried that because of what I went through, and if you like, to be okay to have a baby, it was almost coming true in my head. So she did ask someone to come and sit with me and make sure I was okay, which unfortunately didn't happen. So Leanne came back. That was all okay. She was feeling all right. Jessica ended up having... They never said whether it was the meconium or not, but she ended up basically having a lung infection. They called it sticky lungs.
Oh, yeah.
So they had to incubate her to give her drugs. And in a very short period of time, they came in and said, look, this is the situation. You can come and see her. We're going to have to incubate her so she doesn't have to breathe for herself. We can get the drugs inside her. But if it didn't work, we may have had to have gone to Nottingham Queen's Med, because they've got a new baby ICU unit there. So we may have been moved, but thankfully we didn't. Jessica responded really well to the drugs. Spent, I think it was only like a day in total in ICU, but we spent 5 days in hospital because they keep giving her the rest of her antibiotics, as well as Leanne. And then the doctors kind of came through and gave us debriefs and things. And when they came through to give us debriefs, they said, are you okay? And Leanne was like, yeah, I think I'm all right. And again, I think it's those hormones that are released because of pregnancy. And I said, I'm not. And they basically turned around and said, we don't do anything for dads. And I was like, okay. What do I do? And they went, well, you can't do anything while you're in hospital. You can ring your GP and things, because one of the nights, it might have been the first or second night, I was actually, not loudly, but I was shouting in my sleep, making sure Jessica was okay. She wasn't actually in the room with us, which worried Leanne. Lots of process there, isn't there?
Yeah, and I'm not one for lack of words, as we know, but how long were you stood in that room on your own?
I think I was in there for at least an hour, if not 2. I can't remember how long Leanne was in. When we went through, we had like a debrief months afterwards, because when there's a traumatic birth, I don't know what the triggers are for it. It automatically, in the NHS, they automatically kind of put a case on, or they have to then follow it up. And I didn't realise I was actually with Jessica on my own for an hour until they took her away, until I pulled the button, which it didn't feel like that.
Yeah.
And then I don't know the period of time between Leanne finishing her surgery, coming out of recovery, coming back into that room, and then they cleaned it up and everything. Someone did come in eventually and clean it up while I was in there, which was also a bit, but there was like bedpans that they'd not taken away and stuff. I have since kind of sought help just to make sure I am okay. So I've been diagnosed with PTSD and I'm having what's called EMDR. So it's eye movement disorder something. So it's like CBT for anyone that's listening that's had that before, but kind of on steroids, I guess. So that actually started this week. I've gone through Derby Talking Therapist, which is the old Trent PTS or whatever it's called. So I have kind of sorted that out. It's taken a while. It's taken nearly a year to get things sorted. But yeah, that was the birth.
I've got a friend, paramedic, and struggled with PTSD and had that treatment and was very, very successful, which is why I lit up when you mentioned it.
Yeah.
But goodness. Okay, so in that moment, you're laughing at me, speechless. In the moment where you asked for help and they said, you don't help dads, because I think it's absolutely incredible that you advocated for yourself. And I think this is very, very powerful conversation because I know there'll be people that won't. So what was your drive to kind of go, hang on a minute, no, I need help with this?
Some of it was Leanne kind of helping advocate for me, because when you get married, everyone says you're having children, or it'll be you next, or if you're not married, so you'll be next to be married. And then the minute you've had a baby, it's, oh, you have another one.
Oh, yes.
So we've been having kind of those conversations, and I think at the minute it's not a no, but it's not a yes. But then one of them is Leanne's like, well, we'll have that conversation when we're ready, but she wanted to make sure that I'm mentally okay for it, because we didn't want another situation, because I didn't really know I needed help back then, because when Leanne had her cervical cancer, it wasn't really a thing that you could have. Well, not really. Mental health has come on a long way, I think, in the last probably 5 years, maybe a little bit more. So I didn't realise at the time that I needed support from Leanne's cancer. And I think she was advocating for me to kind of have that done, and I kind of realised that I do as well. There's a few things that have happened where I'm worried. So I don't know whether it's just a normal new parent thing, but like I'm constantly worried if Jessica's breathing at night in bed. And then recently we've been to, and this was literally the weekend just gone, Jessica, bless us, had a chest infection, went to the walk-in centre to get the diagnosis, and they turned around and said, only one of you can come in. And then I wouldn't say I had a panic attack. It wasn't a panic attack, but I just got very anxious in the room, especially when I could hear Jessica cry, because you're doing something to my daughter and I'm not there with her. You told me I can't go in. And it made sense for Leanne to go in. That doesn't bother me that Leanne went in. It just bothers me that I'm not there to support, and it just, I guess, get flashbacks and things. When anybody speaks to me, Leanne can't remember much of the birth. I can remember everything. And I don't know whether some of that's just because of my neurodiversity as well, but I can remember it all in detail.
And how has this, I mean, thankfully everyone's okay, but that's a lot on your shoulders. Has it had any impact on your relationship with Jessica at all?
I think we've got a special bond purely because Leanne had the initial skin to skin. You know, I was able to cut the umbilical cord and do all that kind of stuff. And then I think she must have held Jessica for, I don't know, maybe 10 minutes. I can't remember how long it is when they inject you. If the placenta doesn't come out, you've got to go and get it removed. So she must have had her for probably not even a full 10 minutes. I can't remember how long it is. Whatever the time is that for the injection of the drug that helps release the placenta, Leanne didn't even hold her for the full time because of the amount of blood she was losing. So then I basically had that skin to skin, and I had that bonding moment with Jessica for a good hour where it was just me and her. And then, she shouts for me quite a lot and different things. And I can't compare with other dads, but she does come to me different things, and I think we've got that special bond.
Daddy's girl.
Yeah, she can have what she wants. It's fine.
That's fine. That's lovely. How was it when you left the hospital? How were you both feeling then?
That's a loaded question, because we left the hospital. We don't think we should, in hindsight, we don't think we should have left when we did. And purely because it was maybe 7-8 o'clock at night. It might be when we got home, but we left quite late on in the day. And we'd had Jessica in our room from, I think, day 4. Well, not day, we were in for 5 days. So like the second day, I think she was able to come up to us because she was responding well, maybe later that day. It might have been the day after. So we'd had quite a few days with her where we were looking after her and everything. The problem was that I find is, as much as the NHS is great, there's so many mixed messages. So Leanne was struggling breastfeeding a little bit, and the information, depending on which midwife you had, was completely different. There was no this is how you know, obviously techniques and stuff are a little bit different, try this, try that, but every midwife was trying to do it different. So that was a bit of a struggle. And then we got home, and then it was like, oh, we're home, what do? We need to eat, we need to do this. We're not kind of, because it was in the middle of the night as well, it's like, we need to get to bed, we need to get Jessica to bed. So it was fine, but it was just like a lot of emotion from that.
Exactly that's why I asked, because you're kind of surrounded by people, then you're not, but you've got all of this people telling you kind of what to do and what to think at that time, and then that noise is gone and it's just you in the silence. Goodness me.
So from the birth until kind of maybe a week or so afterwards, we had a lot of tears. Like I was a bit of a mess for a few days, couldn't really talk about the birth without crying, and then Leanne had a few moments herself. But once you kind of get into the routine, it's fine. Once you know you're okay and the health visitors come round and things,
What helped you the most with any of, your whole experience? What helped most?
Just Jessica, just smiling at you and stuff, and playing with you, and just having that. I know a lot of people say it, and if you've not had a baby, you don't realise, but there's nothing like that love. Like, as much as I love Leanne, once you have a child, you didn't realise you could love something so much. And obviously myself and Leanne are a great team as well, so we just tag teamed it, and thankfully I had a month off work. I think it was a little bit more than that as well, because it coincided with Easter and whatnot with because I think Easter was a lot later last year, so then I ended up having probably maybe 5 to 6 weeks off work. So thankfully, if I'd only had 2 weeks off, I'd have pretty much used the whole week being in hospital. So thankfully I had a lot of time off as well, so we could kind of get the routines and whatnot.
Oh, incredible. And did you have at that point any outside support as well? Did you kind of reach out at that point, or were you just sort of in the early days of being parents and finding
just kind of early days? We had parents to help us, and we had our like NCT group, but we were the first to have a child, and then someone was like 2 or 3 days later, so we, at least after a few days, we could share. I think that there was other groups that the mums made once they'd given birth and stuff, so at least we could share some things with them. And then obviously as the rest of the babies come along, like, you're all sharing stories, and the mums have like the breastfeeding group or whatever it is, so that helped. And then the health visitor coming round, they were coming around quite a bit as well, just to help support, which was good.
Oh, amazing. Oh, I love that, because as awful as it is, there's so many positives out of that. It strengthened your relationship. Jessica reassured you that it was going to be okay. And I think it's just so lovely. What advice would you give other parents if that ever was to happen to them, do you think?
If you need to speak to someone, speak to someone. Like, I'm available. You can get in touch through yourself. If any other dads wanted to talk, I'm definitely no therapist, but I've been through a lot, and at least we can share stories and different things. Definitely talk about it, and in hindsight, try not to panic, because they're in the best hands. But if in doubt, ring, press the button, whatever it is you need to do, because you never know. You're better off knowing what I know now, especially because as they get older and different things as well. A doctor said this to us, is if you think it's just a cough, but you're not sure if it could be croup or whatever, just go and get it checked out, because there'll be the one time that you don't go and get it checked out and it could be something more serious. So just do whatever you need to do to keep your little one safe, and yourself safe as well. If you don't think you can handle it, just tell your partner and seek some help. But if there's times where you just need a break, then that's yourself telling you, can't quite deal with the child right now, my cup's full. Go for a walk. If you're allowed to go and play a game of golf or whatever, just make sure you take that time. Well, sometimes it's easier said than done, but it's 4 hours as well out of the house. But just make sure that both of you take time for yourselves and for each other. I didn't realize it got harder as they get older. It's easier in the early days when there's a very much a routine: eat, feed, change, sleep, eat, that kind of thing. When they get older and they have a regression every couple of weeks and jabs and bugs and all that, it gets harder because their sleep pattern isn't quite what you'd expect it to be, and they decide, I'm not sleeping today. Brilliant. So you don't really get time for yourself sometimes.
Yes.
But just make sure you have that time for yourselves.
Amazing. Well, when did you first reach out for help for you?
I think it was just before Christmas, I think.
Okay. So quite a while.
Yeah, I wanted to, as daft as it sounds, I'm not bothered about, I don't mind people knowing that, I needed help and things. It doesn't bother me at all. I think I just wanted to make sure I wasn't overreacting to the situation, because sometimes, time sometimes can be the best healer. But given everything that happened, and I just didn't want it to be a factor for us not having another baby, when Leanne said, I told you to go and get help. And Leanne's also been seeking help as well. that's a little bit with the birth, but then we've gone through some family deaths and stuff as well.
Yeah.
And it's been a lot. Her maternity leave hasn't been the best. She's had to deal with a lot of other stuff as well as having a baby. So we kind of went on the journey together, to be fair. So we're both kind of seeking that help. And it took a while, I think, might have been slightly after Christmas, but I think from actually going to the doctors, having that appointment, getting an initial diagnosis and waiting, I think it's been about 8 weeks, maybe a little bit more, to get a therapist and then start the sessions.
That's actually relatively quick.
I don't know if that's because of what I've been diagnosed with, though, if that makes sense. I don't know if PTSD is a bit higher than someone that might need CBT.
8 weeks sounds a long time, but it isn't as well. Do you remember the first thing that you said when you kind of went for your appointment?
I'm concerned that I might not be right, if that makes sense mentally. It was hard to explain, and then we went to our local GP, and there's a mental health person there like once a week or once every couple of weeks. So I just kind of went bleh to him, a little bit like what we've gone through here, and then talking about some of the family issues that we've had with deaths and things as well. And he went, yeah, you need some help. And he was the one that said that it seems like you've got PTSD and you'd need the EMDR treatment.
Yeah.
So yeah, that was kind of like where we went. I just said, look, I think I need help, but if you tell me that I'm okay and whatnot, that's fine. But I'm at least making this first step. Yeah.
Well, thank you for sharing that. And I asked because I think sometimes people genuinely to go and ask for that help need all the sort of answers and need to have a script of what to say. So I had a feeling that you went in and went, I'm not okay here. It came from there. And I think it's so important for anyone that is struggling to just kind of say that I'm not okay. I don't know what it is, but this has happened and I don't feel right. And I think it's perfect, isn't it? Because it's exactly how you're feeling.
Yeah. And it might be that you feel okay day to day, but whenever you talk about the birth or whatever, if it starts to upset you again several weeks, months later, or you can vividly remember it and things like that. Not that I'm diagnosing anyone, but from what I've learned, that is kind of your brain's not fully processed it, or there could be triggers. For example, not long after Jessica was born, so she was born in March, it might have been May, I went to see the new Fantastic Four film. It's fine, went on my own, don't mind going to cinema on my own. And then there was a birth of a child in it, and I was crying in the cinema.
Oh, shit.
So it's things like that where you kind of like, okay. And I don't know whether it's because I've got a child now, because like there's certain things on TV shows where you kind of then, it affects you more. And I don't know whether it's because you can now relate to it, but yeah.
Oh, no, but thank you. That's really interesting that you say that. But yeah, it's not a diagnosis, it's an understanding. And sometimes that's what we need, someone to understand. Out of all of this, what's the best bit of being a dad?
Oh, just messing around with Jessica and just different things. Like, you don't realise how quickly they pick up things from you. You know, you can blah, 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 blah with your lips, and she now does that herself. So she was making a noise once and I was just putting my finger on her lips and making the noise, and she now does it herself. There's just little things that we do that we don't realise she then picks up, and now she's starting to walk as well. So she's just terrorising the living room, and but it's just like the smile, and she's now kind of starting to, she's not learned how to kiss, but kind of puts her mouth towards
is it the open
you.
mouth?
Yeah, which is a bit grim if the teeth in, and you're like, oh god. But it's still cute. But yeah, just having that little you there, just chucking food everywhere. She's having a breakfast at the minute, and can imagine yogurt up the wall or something. But yeah, it's just like every day's a new day with a baby, and you kind of don't realise until you've got one that how quickly they progress.
Oh, it's crazy.
It's crazy, yeah.
Oh, I love that. Yeah, the open mouth kisses. I don't remember when they stopped. But all of a sudden you're not covered in their whole mouth, and you're like, oh, okay, it's quite, then you actually miss the grimness of it, because it's very weird. And what are you looking forward to next?
Well, we've treated ourselves to go to Florida in June, so we're taking her there. My mum and dad go every year for 3 weeks.
Wow.
Since they've retired, so they just hire a villa, and they don't go to the parks and stuff, although they've got tickets because we've got tickets. So after Leanne's mum passed away, we just went, let's do it. Let's spend some time with my mum and dad over there. So we're going there. But it's just watching her grow up and become her own little person. She's very independent, but very sociable. So there's been some of the little legs classes and other things that Leanne's gone to, and she'll just go and sit on the instructor's knee if it's a kiddie thing. So a bit wary that she might not have too much of a stranger danger, shall we say, but that's something hopefully we can teach her. But she didn't cry when she went to nursery, so she's not fully started yet. She's just having the initial days, but she just gets on with it. When she's been ill over Easter, we think that she's missed that social interaction with other babies and things and got a bit bored, and then Leanne takes her to a class, and then she just wanders off and starts playing with other children.
Oh, it's amazing.
Grabbing their ears and stuff.
I can be honest, as an instructor, it's lovely when the little ones come over because you just feel so trusted and special that they've chosen you. You feel like a rock star. So she is making numerous people feel like rock stars, believe me. It's lovely. Yeah, I get the stranger danger thing. It's when your kid puts their arms up to people and you're like, oh my goodness, what you do. But yeah.
Randomly holding other people's hands and stuff, and you're like, that's not
family, thanks. Yeah, but I love that. There's so much to look forward to, and there's so many positive out of such a terrible story. I think there's so many positives. You've advocated for yourself, but I just think for any dad struggling, I'm so glad that I've spoken to you and that you've kind of showed that it's okay to not be okay, and you know, it impacts dads too. So I'm so grateful that you've shared this. I really am.
I'm all up for advocating more. I know there's I can't remember what it's called, but there's a dads group or something that they're trying to get going, just to advocate more for the dads, because in a way you kind of do feel a little bit helpless. During birth, Leanne had a TENS machine, so I was the boost button. So she'd like boost me and things like that. So I had something to do.
Yeah.
But yeah, you kind of feel a little bit helpless because, especially when there's a lot of doctors there, you just kind of just stand out the way. Yeah. Maybe hold their hand if you can get that close. There needs to be more done for dads, to be fair. Yeah. I know mums go through it all, but at the end of the day, you're witnessing everything and feeling helpless.
It's care for the carer as such. There's some great dads workshops, and I think dads are starting to advocate for themselves. And the Nottingham Baby and Toddler community, Rebecca, who runs that, her partner runs some dads workshops and things like that to get dads together just to kind of share this story. It's absolutely brilliant. Well, you'd have to start something as well.
Yeah, why not? Yeah, I don't mind.
Perfect. Right, I'll be nagging you about that.
I'm up for it.
Oh, excellent. Well, we'll definitely have to speak again, and I really am grateful for you coming on board today and sharing your story.
Thank you for having me on.
No, thank you. And if anyone obviously wants to get in touch with Ali and speak more, that would be amazing. Contact me and I'll put you in touch as well. And watch this space, because I'm going to be convincing him to do more for dads. So thank you so much.